How many people in this audience have heard of or know someone with Tourette syndrome? We will talk more about that later. But I want to begin by telling you a story about a family friend has Tourette syndrome, and he was a blunt of terror, teased by classmates, teachers who did not know how to deal with his problem. He probably claimed that although Tourette's will never go away, he has become a strong person because of Tourette's. At the end of my presentation, I want you to understand what Tourette is, the cause and effect on the individual, and how you need to react when encountering someone with this problem. Let's begin about talking about Tourette's. What is Tourette's? Tourette syndrome is a neurological disorder where a person has motor and vocal tics. Tourette syndrome affects the body brain, the nerve syndrome by causing tics repeatedly uncontrolled movement or involuntary vocal sounds. Tourette syndrome (TS) causes people to have tics. Tics are suddenly twitch movements or sounds that people do repeatedly. People who have tics cannot stop their body from doing these things. Tourette syndrome is named after a person who described the condition in 1815, Dr. George Gay DeLo Tourette. Tourette syndrome is a chemical in the brain that carries nerve syndrome. Your brain has two halves of nerve syndrome working together for your body to communicate. Tourette send a signal to the brain which send a message to the spinal cord that control your muscle and internal organs. Like I said earlier, it is a type of tic uncontrollable. Tourette syndrome is not contagious. You cannot catch it from someone who has this disorder. The following facts may increase the risk of developing Tourette's. Actual genetic. Relator, such as a sibling of a parent, has Tourette's, the person that's risk of development is specifically high compared to other people. Premature birth. Babies who born premature are high risk of developing Tourette's. It's not been proved by scientists which chromosome the genetic are involved. It is believed that the environment played a role along with the genetic. Tourette syndrome is a neurological disorder that occurs in all groups of people, both male and female. However, male is more likely to be more affected than female, 3 to 4 times more than female. Tourette syndrome is an involuntary movement called tics. It is believed that Tourette's may be inherited. One sign is simple motor tics, or sudden brief repair remove movement that involve a number of muscle groups such as blinking your eyes, shoulder shifting, head or shoulder jerking. Shoulder, shoulder shifting is one of the most common simple motor tics. Others include blinking eyes, nose winking, head twitching, biting your lip. Another sign is complex tic, consisting of series of movement perform in the same way. For instance, a person might reach out and touch something repeatedly, or kick out one leg, then the other one. Here is some more examples: punching, touching objects, jumping, and twisting. Complex motor tics also include hitting yourself, biting yourself. Complex, complex vocal tics may include clearing throat, coughing, sniffing, snoring, or barking. Complex vocal tics include repeating words out of tense, echo what someone else say, and speak out loud. When both motor and vocal tics are present and last for more than 1 year, the disorder is called Tourette syndrome. A number of orders often occur along with tics signs. For example, more than 50% of people with Tourette syndrome also have ADHD, and 30% to 40% also have OCD. What we as individuals can do when encountering a person with Tourette syndrome. You should give the child or the person a chance to be independent as possible and encourage him or her to express themselves. Let them have challenges, and more important, praise them more than punish them, and give them support. What would help them? This will help them relax and learn themselves to love themselves. Encouragement from all people, especially from their family, friends, and their school. Possible medicine to help control or reduce Tourette's or related conditions such as ADHD or OCD. All medicine is not helpful for everyone who has Tourette syndrome. Non-complete removement Tourette's and all the medicine have side effects. Weigh against the benefits. There are no specific tests that can diagnose Tourette syndrome. Instead, doctors must apply the history of signs to diagnose the disorder. Do anyone have any questions? If not, just remember Tourette syndrome. Sometimes it could be painful, sometimes it won't, depending on how bad you have it. So if you see someone with signs of Tourette syndrome, don't tease them. It's not contagious. You cannot catch it. Just show them some love.